Hey everyone, we're here back at Park Avenue LASEK, and we are with Leonard, who is one of our post-op patients at the moment. He had his surgery how long ago?
September 28th, 2023 was my
Nice.
surgery, so about 6.5 months ago.
Okay, and then how high was your prescription?
It was off the charts. It was like -13 one eye, -14 the other.
Sheesh, yeah, no, that's a super extreme prescription, yeah.
Yeah.
Anything over, I think, -9, you can't even get LASIK done. So with the LASEK, which is non-cutting, you're able to get it done. -13, -14 is about as extreme as it gets.
If I may, I was
Yeah.
actually glad that I didn't do the cutting method.
Yeah, of course. Yeah.
For like some obvious reasons that Dr. Chynn had mentioned. And doing it like this right here was much more easier for me. I was kind of like bored, like having like do nothing for the past 6-7 days, but like doing it in a method that's safe really helped me out.
Sure. Yeah, absolutely. No, we stopped doing cutting LASIK back in like 15 years ago. I think now Dr. Chynn used to do both LASIK and LASEK. He probably did like maybe 15 to 20,000 of the LASIKs.
Right.
And then he's doing side by side with LASEK, and he's like, look, I'm only getting like seeing like bad night vision, seeing dry eyes and all that from like LASIK, but never from LASEK.
I think I think you mentioned that he got LASIK done in one eye and
He
LASIK
did.
in the other.
He was the first doctor in the tri-state area to even get LASIK done back in 2001. It's kind of like if you go to a dentist and the dentist has bad teeth, it seems weird, right? So if there's an eye surgeon who's not getting LASIK done, but he's pushing LASIK on people, obviously it's not a good look either. So he wanted to be a patient himself, and he goes, look, I'm getting dry eyes, I'm getting bad night vision on that eye too. Obviously I shouldn't be doing this for my patients anymore. There's a better technology out there, right?
I agree.
So that's exactly what he did. He switched over to LASEK entirely with non-cutting. And ever since then, all of his patients have been doing well. Plus, you can do much higher prescriptions, such as yourself.
Right.
And you're with the NYPD, right?
Yes, as a administrative worker or a clerical worker.
Nice. So yeah, so you do like a lot of like computer screen work all the time and all of that,
Yeah.
right? What was it like when you were wearing your glasses, which were like kind of like these in terms of like the thickness of them? Really, really thick. If you can see that, guys. Oh, you got a pair as well?
Yeah. It's not like exactly my glasses,
Right.
but
Look
it
at the
was something
difference.
similar to this.
Yeah. So -13, -14 is like very, very thick lenses.
These are like my original glasses right here, if anybody could see that.
Oh man, look at that. It's hard to see, the focus is a little bit off, but yeah, those are super thick.
Yeah.
All right, so what was that like on a daily basis? Did your eyes get tired? Was it?
It was tiresome. It was annoying because they were like always slipping off of my face, and my vision was awfully limited.
Right.
So like I couldn't like really see as well even with glasses because my prescription was so bad. It was just like I was very myopic back then, and it was just getting worse and worse.
And I was looking at your chart before, and it looks like we said your best possible vision was going to be 2030. Did Dr. D tell you today what you were seeing?
2025.
So even though we said the most you could possibly see is 2030, with this surgery, we're actually seeing even better than that. So like some people who are viewing right now may not know this, but not everyone is capable of seeing 2020. If you have a very extreme prescription, some people have like an upper limit. Their version of 2020 can be 2030, could be 2040. So in your case, we were saying it's not likely you can see any better than 2030. Now you're seeing 2025. Right. So legal to drive during the day is 2050. Legal to drive at night is 2040. So we knew that 2030 would be good because you had never seen 2020 in your life. So for you, that would be the equivalent. But you're actually seeing 2025. So it's kind of like, I would call it a modern day miracle, but Dr. Chynn has performed tens of thousands of these by now. So for him, it's old hat. For you, it's probably like a spiritual experience, I bet.
It most certainly is.
Yeah. What was it like when you sat up for the surgery, like the first time? Were you able to see a few things, or?
I was able to see a little bit. I was like quite groggy from like all the laughing gas. And
sure,
everything,
yeah.
But,
so like it didn't hurt or anything like that, right?
No,
awesome.
no hurt.
All right, good, yeah.
I mean, it was kind of tough trying to stay awake though, but
yeah. Well, that's the idea. We don't want you to like blink too much. We want it to be easy for you. We don't want you to like feel any kind of discomfort or anything like that.
Right.
Like I had my own surgery done 12 years ago, but I was not like you. I was like a -2, -3, that kind of thing. So it wasn't nearly as bad for me. And I remember when I looked up, everything was like much sharper than I had expected initially. Obviously for you, it's a much higher prescription, so it took a lot longer, to get there. But the name of the game is safety, and of course, you wouldn't have been able to do any other kind of surgery anyway because it's such an extreme case.
Right.
But thank you so much for sharing your story. And
thank you. I'm glad to have shared my experience with everybody, and those that are looking for to get their eyesight improved, and looking for an alternative other than what we see in the modern day tech. Definitely choose Park Avenue LASIK. Dr. Chynn is very caring with his patients, and you couldn't go wrong going here.
Yeah. Okay. All right. Thank you so much, Leonard. I really appreciate it, and congratulations on your new vision.
Thank you again. Yeah.